I'm Jackie Huber. I'm an emergency psychiatrist at St Vincent's Hospital. St Vincent's Hospital remodelled its emergency department a couple of years ago now. The people who conceived of that environment recognise that at St Vincent's we have a much higher percentage of people presenting with mental ill health than almost every other hospital in New South Wales. And they felt that people presenting with mental ill health or psychiatric complaints deserved an environment that was different to the one that we had been using. They decided to devote a specific area within the emergency department to people who had psychiatric complaints or mental ill health. We acquired this thing called a safe assessment space, which we call a SAS, which is an area within the emergency department that has walls and doors and is a specific room essentially, which is designed to be low stimulus, and it's exclusively staffed by mental health nurses. St Vincent's is the only hospital in New South Wales, certainly, that has a little area of the emergency department devoted to mental health. Along with that geographical change and environmental change has come a staffing change and a bit of a cultural change as well. One of the reasons SAS is really important is that it is exclusively staffed by nurses who specialise and have a specific interest in mental health. And they are very good, it is their specialty, at helping people manage and contain their distress. Ideally, we would tailor the environment in the emergency department to each person coming through the door. Not solely people who have mental health complaints, but everyone. And everyone has different sensory requirements, by which I mean some people respond to light lilting music, some people respond to silence, some people respond to the sounds of the ocean. So one's preference when it comes to stimulus is personal. So ideally, actually, we would be tailoring it to each person. That's very, very difficult. And the reason we haven't done that is because it's very difficult. Instead, we have created this space which is generally low stimulus, and therefore but gives us a better opportunity to tailor stimuli to the people who come through the door. So if it's quieter in general, that means that we can add things to their experience that are specific to their sensory requirements. So it's very quiet, you like classical music, have some earphones, listen to some classical music. And ideally, there's very little background noise, so you can just listen to your classical music. And you're able to concentrate on that sensory experience rather than the noises and beeps and flashing lights that you might usually find in an emergency department. The results that we see in the SAS are anecdotal only. So we have not done a study that reliably tells us what the results are of this type of environment. I can say that within the first 6 months of having built this different environment and having this different staffing model, the seclusions and restraints within the emergency department did go down substantially, approximately 50%. Anecdotally, we believe that that environment has made that significant change.